If you are over 60 and living with sciatica, sudden electric shocks in your lower back, or that burning line of pain traveling from your hip down your leg, pause for a moment before you try another random stretch you found online. Before you push your body into another position that promises instant relief, stop. Because here is something most people never tell you. The more you aggressively stretch that painful leg, the worse it may actually become. You have probably experienced it yourself. You lie on the floor, you pull the leg tighter, you try to stretch harder, and instead of relief, the nerve feels angrier, sharper, more irritated. There is a reason for that. Most of the popular back exercises online are designed for 25 or 30-year-olds with fresh disc herniations. Their spines are different. Their discs are full and hydrated. Their joints are not narrowed by time. What works beautifully for them can be completely wrong for you. After 60, your spine has changed. That is not a flaw. It is biology. Discs gradually lose height, like a sponge that has slowly dried out over the years. The small openings where the nerves exit become narrower. Arthritis may thicken the joints. Ligaments stiffen. This narrowing is called spinal stenosis, and it is incredibly common in mature adults. Now, here is the critical mistake. When someone with spinal stenosis forcefully arches their back, stands ramrod straight, or pushes into aggressive extension stretches, they may actually close the very openings the nerve needs to breathe. Imagine a garden hose lying on the grass. Now picture stepping on it with a heavy boot. The water flow decreases instantly. That is similar to what happens when extension exercises compress an already narrowed spinal canal. Your nerve does not need more pressure. It needs space. And for most people over 60 with sciatica caused by stenosis or age-related narrowing, that space is created through gentle flexion, a controlled rounding of the lower back. That opens those nerve windows instead of closing them. In this training, you are going to learn 3 movements specifically suited for the aging spine. They are gentle, they are safe, they can be done in your bed or in a chair, and they are designed to reduce compression rather than increase it. But before we begin, you must understand one simple mechanical principle, so you never accidentally worsen your symptoms again. Picture your spine as a flexible chain made of small bones, stacked one on top of the other. Between those bones are cushions, the discs, and between each segment are small doorways where nerves exit and travel down into your hips and legs. When you were younger, if a disc bulged backward, arching the spine sometimes helped push that bulge forward, relieving pressure. That is why many younger patients are told to stand tall and extend backward. But after 60, the more common issue is not a fresh bulge, it is narrowing. When discs lose height, the doorways become smaller. When arthritis develops, joints enlarge slightly, the space tightens. If you arch strongly in this situation, you shrink the doorway even further. If you gently round forward, you widen it. That is your key. Now let us begin with the first and safest movement. Exercise 1. Single knee to chest bedside relief. This movement is ideal first thing in the morning when your back feels stiff and uncooperative. It is also excellent before sleep to reset your lower spine after a long day. Lie flat on your back. You can do this in your bed if getting to the floor is uncomfortable. Place a pillow under your head if needed so your neck feels neutral and relaxed. Bend both knees so your feet are flat on the surface. Take one slow breath in As you exhale, allow your lower back to settle naturally into the mattress. Just let gravity help. Now we begin with the right side. Slowly lift your right foot off the surface. Bring your hands toward your leg. If your knees are healthy, you may clasp your hands gently over the shin just below the kneecap. If your knees are sensitive, slide your hands behind your thigh instead, just under the knee joint. This protects the knee while still allowing the hip and lower back to flex. Now gently draw the knee toward your chest, not aggressively, not forcefully, only until you feel a mild stretch in your lower back or buttock. There should be no sharp pulling down the leg, no electric shock, only a comfortable rounding sensation. Hold for 5 slow seconds. Breathe in through your nose. Exhale slowly through your mouth. With every exhale, imagine the lower back widening and softening. Then carefully release the leg and place your foot back down. Pause. Notice how that side feels compared to before. Now switch to the left leg. Lift the foot slowly. Support behind the thigh if needed. Gently guide the knee toward your chest. You may notice one side feels tighter. That is completely normal. The goal is not symmetry. The goal is comfort. Hold again for 5 seconds. Steady breathing. Slow release. After both sides feel comfortable individually, you may try the double variation, but only if the single leg version felt relieving. Lift one knee toward your chest, then lift the other. Wrap your arms around both legs gently, and allow your lower back to flatten into the surface. This position maximally opens the nerve windows in the lumbar spine. If it feels good, you may gently rock side to side. Small movements only. Imagine lightly massaging your lower back. There should be no strain in your neck or shoulders. If there is, place your head back down and support it with a pillow. Repeat the sequence, right, left, both, about 8 to 10 rounds at a relaxed pace. There is no hurry. Relief comes from consistency and gentleness, not force. Now we move to exercise 2, lumbar rotation, the windshield wiper. Stay lying on your back. Keep both knees bent and feet flat. Walk your feet slightly wider than hip width, approximately shoulder width, apart. This creates a stable base. Extend your arms out to the sides in a T shape. Palms can face up or down, whichever feels more natural. Let your shoulders rest heavily into the surface. Now imagine your legs are windshield wipers. Slowly allow both knees to fall together toward the left side. Do not push them. Let gravity do most of the work. Stop wherever your body naturally wants to stop. You may feel a stretch along the right side of your waist, hip, or lower back. Hold for one gentle breath. Then engage your abdominal muscles lightly to bring your knees back to the center. Now let both knees fall toward the right side. Keep your opposite shoulder anchored down so your torso rotates gently. Again, do not force range. This movement nourishes the small joints in your spine. It encourages fluid exchange in stiff segments affected by arthritis. It reduces guarding in surrounding muscles. Return to center. Continue this pattern left, center, right, center, slowly and rhythmically. Inhale in the center. Exhale as the knees drop to the side. Keep your jaw relaxed. Keep your breathing steady. After about 15 slow repetitions, your hips should feel looser and your lower back more mobile. There should be no increase in leg pain. If the pain travels further down the leg, reduce the range or stop. Gentle motion heals. Aggressive motion irritates. Now we move to the third and most powerful decompression technique for those who struggle to get down to the floor. Exercise 3, the seated diver. Sit on the edge of a sturdy chair. Your feet should be flat on the ground. Spread your knees wider than your hips. This is important because it creates space for your torso to move between your thighs. Place your hands on your thighs for support. Sit tall for a moment. Now begin by tucking your chin gently toward your chest. Slowly round your upper back, then your middle back, then your lower back. Slide your hands down your thighs, toward your knees, then toward your shins. Allow your torso to fold forward between your legs. Let your head hang heavy and relaxed. Do not strain to touch the floor. Only go as far as feels natural. Once you reach your comfortable limit, pause there. Take 3 deep breaths. With every inhale, feel your ribcage expand toward your back. With every exhale, allow gravity to gently lengthen your spine downward. This position opens the lumbar spaces and reduces nerve compression without forcing extension. When you are ready to come up, do it slowly. Walk your hands back up your legs. Use your arms to assist. Stack your spine upright, one segment at a time. Lower back, middle back, shoulders, then head last. Pause upright before moving again. Repeat this movement 5 times whenever you feel heaviness, pressure, or numbness building in your legs. Now, before we finish, there are hidden daily habits that can completely undo your progress, even if you perform these exercises perfectly. You have now learned the 3 safest decompression movements for the aging spine. But exercises alone are not enough if your daily habits continue to irritate the nerve for hours at a time. This is where most people over 60 unknowingly sabotage their own recovery. You may be doing everything right for 10 minutes in the morning, and everything wrong for the remaining 15 hours of the day. So let's correct that. Hidden mistake number 1. Forcing perfect posture. Since childhood, you were probably told to stand up straight, chest out, shoulders back, no slouching. For a young, flexible spine, that cue is often harmless. For a narrowed, arthritic spine over 60, that advice can backfire. If you have spinal stenosis, standing with a rigid, military posture can increase compression in the lower back. When you push your chest forward and arch your lumbar spine, you close down those already tight nerve windows. And then you wonder why your leg begins to burn after 5 minutes of walking. Here is the truth. A slight forward lean is not weakness. It is protection. Watch people your age in the grocery store. Many naturally lean forward a little while walking. That is not poor posture. It is the body's intelligent strategy to open space in the spine. If leaning slightly over a shopping cart reduces your symptoms, that tells you something important. Flexion opens space. Extension closes it. This does not mean you should collapse forward completely. It means stop forcing an exaggerated upright stance through pain. Walk tall but relaxed. Allow a gentle forward bias if it eases pressure. Your spine does not need to look perfect. It needs to feel safe. Hidden mistake number 2. Heroic walking. Yes, walking is healthy. Yes, movement is medicine. But walking through nerve pain is not bravery, it is irritation. Many people over 60 are told, just walk more, so they do. They push themselves to go farther every day, even when the leg starts tingling or going numb. They grit their teeth, they power through. That approach works for muscles. It does not work for irritated nerves. A nerve that is compressed does not respond well to stubbornness. Here is the smarter rule. Walk until you feel the first sign of discomfort, not severe pain, just the beginning of tightness or tingling. The moment it appears, stop, sit down, perform the seated diver you learned earlier. Rest for 1 to 2 minutes, then resume walking. This method is called interval walking. Short bouts, frequent resets. This strategy allows circulation to improve without overloading the nerve. Walking with breaks rebuilds tolerance. Walking through escalating pain increases inflammation. Remember, mild discomfort is information. Sharp, spreading pain is a warning. Listen early, not late. Hidden mistake number 3. Sleeping without support. You spend 6 to 8 hours every night in one position. If that position compresses your lower back, you are reinforcing the problem daily. Let's start with back sleepers. If you lie flat on your back with both legs straight, gravity pulls your pelvis forward. This increases the arch in your lower back. That arch narrows the nerve openings for hours. No wonder mornings feel stiff and painful. The fix is simple. Place a pillow under your knees. This small change flattens the lumbar curve gently. It keeps the spine slightly flexed. It gives your nerves a full night of decompression. Now let's talk about side sleepers. When you lie on your side without support, your top leg often drops forward. This rotates your pelvis and twists the lower spine. Imagine wringing out a towel. That subtle twist can irritate a sensitive sciatic nerve all night long. The correction is essential. Place a firm pillow between your knees. Make sure it is thick enough to keep your hips stacked directly on top of each other. This keeps your pelvis neutral. No twist, no rotation, just alignment. Some people even benefit from hugging a small pillow to prevent the upper body from rolling forward. Tiny adjustments, major difference. Now let's go deeper. There is one more mistake that almost no one talks about. Hidden mistake number 4. Prolonged standing. In extension, standing still for long periods, washing dishes, cooking, waiting in line can quietly aggravate stenosis. When you stand upright and static, the lower back often drifts into extension. The muscles tighten, the canal narrows. If you notice leg heaviness while standing at the sink, try this. Open the cabinet below the sink. Place one foot up on the lower shelf while you work. Then switch sides after a few minutes. This small elevation tilts the pelvis backward slightly and reduces lumbar compression. It is a classic strategy used by physical therapists for decades. You can also lean one forearm gently on the counter to create microflexion. Do not lock your knees. Keep them soft. Little posture shifts throughout the day prevent cumulative compression. Now, an extremely important safety rule. During any of these exercises or adjustments, your symptoms should improve or at least remain stable. If pain increases sharply, if it shoots further down the leg, if numbness becomes more intense, stop immediately. More range is not better. More force is not better. Better is better. And sometimes relief does not come from stretching at all. Sometimes it comes from strength. Many cases of sciatica in adults over 60 are worsened by weak gluteal muscles and deep stabilizers. When these muscles do not support the spine properly, the lower back absorbs too much load. The nerve becomes irritated, not just from compression, but from instability. But strengthening must be done carefully. Aggressive back extensions or heavy lifting can worsen narrowing. That is why targeted, spine-safe strengthening is critical. Now let's talk about the missing piece. You can decompress the nerve. You can improve your sleep position. You can stop forcing painful posture. But if the muscles that are supposed to support your spine remain weak, the irritation will keep returning. Think of your spine like a tent pole. If the ropes holding that tent are loose, the pole wobbles. When wind hits, it bends too much. Over time, stress builds at the base. Your lower back works the same way. After 60, certain muscles naturally weaken, especially the glutes, deep abdominal stabilizers, and small muscles around the hips. When they are not doing their job, the lumbar spine compensates. Another important note: numbness that gradually improves with movement is usually mechanical. Numbness that progressively worsens, especially with weakness in the foot, requires medical evaluation. Know the difference. Now, let's address one final mindset shift. Pain does not always mean damage. Especially in mature adults, nerves can become sensitized. They overreact. They send stronger signals than necessary. When you move gently and repeatedly without provoking sharp pain, you teach the nervous system that movement is safe again. That reduces sensitivity over time. Consistency beats intensity. 5 minutes daily is more powerful than one aggressive 30-minute session per week. Gentle repetition retrains the system. Now imagine this. You wake up. Instead of stiffness, you perform 2 rounds of knee. You place your pillow correctly at night. You walk in intervals instead of pushing through pain. You strengthen lightly 3 times per week. In a few weeks, your walking tolerance improves. Your morning stiffness decreases. The burning line down the leg appears less frequently, not because you forced it away, but because you created space, stability, and smarter habits. Sciatica after 60 is rarely about one dramatic injury. It is usually about gradual narrowing combined with daily stress patterns. Change the patterns, and you change the outcome. You now have 3 decompression exercises, 4 daily habit corrections, 3 stabilization tools, a flare strategy, and a safety rule: never push through sharp spreading pain. The only thing left is long-term consistency. Your spine has carried you for decades. Treat it with patience, not aggression. Now I will ask you one final question.